Hi, I'm Nicole Jacinto. Join us on Healthline with 𝗏𝗏𝗏𝗏 as we discuss the latest health and medical topics with doctors from 𝗏𝗏𝗏𝗏. For a healthier and uplifting lifestyle, tune into Healthline with 𝗏𝗏𝗏𝗏 on 𝗛𝗏𝗃 8:10 a.m. Radio Bandido TV. You've got questions, we've got answers.
Watch and listen to Healthline with 𝗏𝗏𝗏𝗏 every Monday from 5 p.m. to 6:30 p.m. airing on Sky Cable Channel 224 and on all DTT boxes, simulcasting online on Facebook and YouTube. Listen and watch on your mobile devices. Just search DZRJ Radio Bandido.
You're about to experience Healthline, a show where doctors from 𝗏𝗏𝗏𝗏 interact with you for a healthy, uplifting lifestyle. Moderated by Nicole Jacinto. You've got questions, we've got answers. So welcome to Healthline.
Hi, everybody, and welcome to Healthline with 𝗏𝗏𝗏𝗏. I'm Nicole Jacinto. I'm your host for this show. And don't worry, we are still continuing our special coverage for the barangay elections. And I'm sure we'll have some reporters who will give us some updates as we continue the show. Now, happy holiday to everyone. It's a holiday, and I'd like to thank our doctor for being with us today, even if it's a holiday. I know there are no holidays for doctors, Doc, but still, thank you for sharing your time and your effort with us. And I haven't introduced him properly yet. Our doctor today is Dr. 𝗠𝗸𝗏𝗏𝗏𝗏. He's an ophthalmology specialist who practices in 𝗏𝗏𝗏𝗏𝗏, of course. And today our topic is cataracts. How are you, doctor? Welcome to the show.
Good afternoon, and thank you for having me. Magandang hapon po sa inyo lahat.
Yes, thank you, doctor. You are welcome on the show. I'm glad the topic of cataracts has come up. You know, there are so many things we can discuss about medical issues, to have a healthier and uplifting lifestyle, and to be informed and educated. And I'm sure you will be our one of our great subject matter specialists when it comes to this topic of cataracts. Okay, doctor. So let's just jump right into it. Cataracts. You know exactly what are they, and for
cataracts basically is the aging of the natural lens of your eye. No, your eye has a natural lens inside, and as we get older, for the most part, as we get older, it becomes less clear. No, so it's like having a dirty pair of glasses. So nagiging scratch and dirty. So your vision becomes blurrier, cloudier, darker. No. And the most common cause of cataracts is really aging. It is age-related. It's just like parang when I tell my patients, it's just like getting white hair or gray hair. You can't help it. It's just really part of getting older. Some people get it sooner. Some people get it later. Some people get a little of it. Some people get a lot. But invariably, lahat tayo magkakaroon ng cataract as we get older.
Okay. All right. So, thank you for answering that. Basically, it's the aging of the eye lens, the natural eye lens.
It's the cloudy, nagiging cloudy yung lens natin. The most common cause is aging. But there are other causes. It can be developmental, it can be congenital, it can be traumatic, it can be due to other diseases. But for the most part, it is really an age-related condition.
Okay. So, how exactly does a cataract start? Well, can you have a cataract in one eye only, or is it always both?
Usually you will get it in both, but it can be unequal. One eye can develop earlier than the other. This is for age-related cataracts. But of course, for let's say traumatic cataract, kung ano yung tamaan na mata, that's the one that will get a cataract. In congenital cataracts, more often than not, they're both eyes. In some conditions, one eye lang talaga, but like let's say in diabetes, you'll get it in one eye first, and eventually you'll get it in both eyes, because these are systemic conditions.
Okay. Thank you, doctor. You mentioned the word congenital, but can I ask you, is cataracts, I'm sure, is developing a cataract, is it, apart from eventually you said we'll all get it because it's aging, do some people not get it even if they age? And is there a genetic predisposition, or is it familial? Is there anything like that in terms of maybe getting it earlier?
There are very rare conditions that can cause developmental or yung congenital cataract that is genetically linked. No, there are also cases that cataracts become a secondary condition because of genetically predisposing conditions like diabetes. No, your diabetes, you are genetically predisposed to that. No, and then when you have diabetes, it can also hasten the formation of cataracts in your eyes. No, so. But again, for the most part, talagang it's really age-related, no?
Okay. Doctor, how come diabetes is such a big factor in getting cataracts in either one or both eyes?
Yeah. Well, diabetes kasi, as you know, causes high sugars in your body. And high sugars can actually cause problems inside the lens of your eye. No? Initially, when you have very high sugars or fluctuating sugars, the lens of your eye, because it absorbs the sugar from your body, fluctuates in size. Tumataba, pumapayat. No? So parang nagbabago din yung grade natin initially. That's usually one of the initial signs of diabetes in the eye, is that you have fluctuating grades, no? And then eventually, when the sugar increases, is consistently increased in your eye, no, you can develop parang more permanent changes in your lens that can cause clouding and darkening of your lens, no? And this is eventually what becomes a cataract.
Okay, thank you, doctor. So, as you said, cataracts can be a secondary illness or condition or disease of having diabetes, and it is linked to that, definitely, because I didn't realize our eye lenses and absorb the sugars in the body.
Yes, correct.
So as you said, just to be clear, I'm clarifying for myself, no, and then jump in and correct me anytime I'm wrong. Our eye lens gets a bit like it gets smaller, bigger, because it adjusts to the sugar.
The sugar, yes. Parang it absorbs the sugar and then absorbs the fluid, no? Kasi parang hypertonic, nagiging hyperosmotic agent, no? So parang nag-absorb siya ng fluid. So tataba yung lens mo, you become more nearsighted. And then pag nag-normal na naman ng sugar mo, mawawala na naman yung hyperosmotic agent, it will go back to its usual shape. And this can happen temporarily. No? And then eventually, pag consistently mataas ang sugar mo, it will cause permanent damage to your lens, and that is cataract, no?
Okay. And so basically, in very simple terms, parang if you have high sugar always, and then it's going back and forth, parang nabugbog lalo yung eye lens.
Yes, correct. Oo, totoo yan.
There's already may predisposition na nga siya na pwedeng I mean, pag nag-age tayo, habang tumatanda tayo,
pinapabilis mo pa.
Pinapabilis mo pa
pag meron kang diabetes, no? So it's important for our diabetic patients to make sure that our sugars are controlled, because the higher your sugar is and the longer your sugars are high, you can get several problems in the eye: cataracts, retinopathy, etc., etc. So we always tell our diabetic patients, please control your sugar. Kailangan talaga yun.
Do cataracts always progress, or can they stop on their own?
Usually they will progress.
It
comes to a point though that it's very, very mature, na parang hindi na nagbabago yung vision mo. It's very, very bad already, no? Nagkakaroon niya ng parang up to a certain point, hanggang doon na lang talaga yung vision, light na lang yung nakikita mo. And then you can say na parang it's not progressing anymore, pero talaga nasa end stage na siya, no? Sobrang pangit na ng vision mo.
Okay. So doctor, some of us have heard things like as you said, cataracts is mostly due to aging, because our natural eye lenses just kind of break down over time.
Yes, correct. Oh, just like every part of your body, no?
Yes. And then because we hear certain things like, maybe we can circle back to this later, but just one question that we hear that, oh, if your eyes get exposed to too much sunlight or something like that, the cataracts will develop faster. Is that true or false?
There is some truth to that, but really hindi siya yung main cause, no? Meron talagang konting effect yan, but it's really not the main. It's mostly tawag dito, degenerative, no? Age talaga siya, no? But exposure to different elements can make it progress a little bit faster.
And perhaps we'll go to the exposure to certain elements and like nature versus nurture a little bit later in the show.
Yeah, sure.
Doctor, you did say that cataracts they tend to always progress, but at a certain point, they may stop, pero malabo na yung vision mo.
Yeah, parang hanggang doon na lang talaga yung progression na dahil sobrang pangit na niya, no? When your lens, let's say the lens in your eye becomes really opaque already, parang wala naman ng room for progression yun. Parang you really can't see anything anymore, no? So in that stage, you really have no option but just really to take out the cataract and take out the opaque.
At a certain point, parang yes, it will progress, but technically it will stop pag ano na siya. That's how broken down already as much as it can be the natural eye lenses are.
Yes. And sana nga hanggang doon lang, sana vision problems lang because that's largely reversible, no? Yung opacity lang. But sometimes cataracts can also cause other issues, no? Like can cause secondary glaucoma, secondary inflammation in the eye when the cataract becomes very, very bad, no? So in that case, it becomes what we call a medical emergency and medical necessity to take out the cataract. Kasi hindi lang siya malabo, it can cause other issues as well that can cause permanent loss of vision.
Doctor, can you just differentiate very quickly glaucoma from cataracts? Because I think a lot of people but they kind of, intertwine both.
So those are the two most common eye problems that we know of. No, cataract is basically an opacity in your lens. No, lumalabo yung lens sa loob ng mata. No, but that is largely reversible. Tanggalin mo yung lens na yun, palitan mo ng bagong lens, malinaw na naman. Parang salamin nga natin, gasgas yung salamin, papalitan mo lang pero okay na. Glaucoma on the other hand is irreversible. No, glaucoma is tumataas ang pressure sa loob ng mata natin at kumbaga nasasakal yung nerve ng ugat natin. So para siyang parang bola o gulong na masyado mataas ang pressure, no? So everything inside the eye parang na-choke including the nerve. And pag na-choke yung nerve na yon, it becomes an irreversible loss of parang nerve tissue. So the vision loss there is irreversible. Now cataract, when it becomes too bad, sometimes can cause a secondary glaucoma that can cause a more permanent issue. And in that case, mas kailangan mong tanggalin yung cataract na immediately. No?
Okay. Thank you, doctor. You're so articulate, and we just have to take a short break. So it's like short breath, but short break. We'll be right back to talk more about cataracts and perhaps also like the different types of cataracts if at all, and so many, but so there's so much more about cataracts to learn about today from you. Thank you, doctor. Please to the audience, our viewers and our listeners, stay tuned. We'll be right back with Dr. 𝗂𝗵𝗹𝗶𝗏.
You're listening to DZRJ 810 AM. We'll be right back after these reminders.
Hi, this is Dr. Jacinto from Makati Medical Center, and I'm happy to share that our world-class quality healthcare with the heart is now more accessible and affordable at Makati Med Care Access, Araneta City. What's more, Makati Med Care Access is the only single-use hemodialysis center in Araneta City. It's now easier for patients to avail of renal care services right in the heart of Cubao. We offer health screening and diagnostic procedures in this facility at affordable rates. You can get services such as mammogram, ultrasound, lab procedures, ECG, and many others. We believe that access to affordable, quality, and compassionate healthcare is a basic human right. And we at Makati Med Care Access Araneta City are doing our best to make this possible to more people. You can find us at the ground floor of Manhattan Plaza Tower 1 in Araneta Center, Cubao. We are open from Mondays to Saturdays from 7 a.m. to 5 p.m. and Sundays from 7 a.m. to 4 p.m. For inquiries, you may reach out to us at the numbers below. We look forward to serving you here at Makati Med Care Access, Araneta City. This is Dr. 𝗛𝗶𝘁𝗵 from Makati Medical Center, and I'm happy to share that our world-class quality healthcare with the heart is now more accessible and affordable through Makati Med Care Access at 𝗂𝗶𝘁𝗵𝗹. Available for outpatient care services, our 𝗂𝗶𝘁𝗵𝗹 site offers consultation and diagnostic procedures such as medical assistance, hospital admission assistance, blood pressure monitoring, laboratory tests, and X-ray, among others. This is really convenient for those residing in Makati and nearby areas who do not want to go to the hospital to have these treatments and procedures done. We believe that access to excellent quality and compassionate healthcare is a basic human right, and we at Makati Med 𝗂𝗶𝘁𝗵𝗹 are doing our best to make this possible to more people. We are open from Monday to Saturday at 8 a.m. to 5 p.m. at the third floor of 𝗂𝗶𝘁𝗵𝗹 in Makati City. For inquiries, you may reach us at these numbers. We look forward to serving you here at Makati Med Care Access 𝗂𝗶𝘁𝗵𝗹.
You're back with Healthline, keeping you healthy. Moderated by Nicole Jacinto.
Okay, hi everybody and welcome back to Healthline with Makati Med. I'm your host, Nicole Jacinto. I'd like to say hello to Mommy and Tata. They're watching right now. And I can't read the other stuff from people who are watching, but I'll try to get to you later. Okay, Dr. Valero. Thank you for being on the show. We're discussing cataracts. Dr. Valero, of course, is an ophthalmology specialist in Makati Med, and he's given us great information so far. And Doctor, earlier, you did mention that a cataract is basically the aging and the breaking down of the natural eye lenses that we have. That's how we get cataracts, and your vision gets cloudier. And you did mention like that people with diabetes should be a little bit more careful. It's related to the cataracts because that can hasten the onset of the breaking down of the lenses. And then, so I'm assuming the demographic that you see most in your practice is a bit of the older demographic. But correct. Is there like, are there more females or males? Have you noticed that come to you into your clinic to see you for cataracts? And are there younger people too? Should younger people be, are they at risk of developing cataracts as well?
Okay. Well, for gender predilection, no, wala naman, no. It usually affects both genders equally, no. In terms of age, yes, a majority of the patients that we see are, a little bit older, no. Usually, cataracts would start forming siguro around 60s, no, mas significant siya. Although again, for those who are diabetics and other metabolic conditions, it can happen a little earlier. And then younger still are those pediatric patients with congenital or developmental cataracts. Those are not very common, no. And then we see siguro a younger male traumatic cataracts, no, natatamaan yung mata. So yon, mas usually male ang gender predilection ng traumatic, no? But we do see some female also na traumatic cataracts, no?
When we talk about traumatic cataracts, and that's because of an injury,
Injury, yes, natamaan, no, sometimes from work, no, foreign body, or minsan nasuntok, or minsan accident, no, so those things can happen and can cause clouding of the lens eventually, no.
Okay. When you see, well, you don't have to answer this question if you don't want to, but without revealing anything about histories of your patients in particular, have you come across females who have come into your clinic because of domestic abuse? Like they have
a few, no, a few. Not necessarily cataract, kasi usually very acute, no.
Okay.
You see parang hematomas, no, parang black eye, sometimes may fracture, no. But cataracts usually develop over time, kasi, no, unless it's a sharp injury, no, parang foreign body yung tumama. But blunt injury like a fist, no, usually it will manifest as other more acute issues like yun nga, hematoma, swelling, no, edema of the back of the eye, no. But sometimes I've seen one or two na only history niya is trauma, no, from getting hit, no. It's not very common, no, but it happens. Yeah.
Okay. Sorry, I asked you, I told you earlier that you don't have to answer if you don't want, because I don't want some of your patients to feel like parang they're, oh my God, about me. But
it's been reported. It's been reported then.
But I do think that with a lot of injuries, domestic abuse is something that I'm saying. It's my opinion. And no, actually, I'm saying it. It should be talked about. It should be discussed. We should support women who, as a society, and I'm sure as a medical doctor, you have seen a lot of this. We should support women who are who have undergone domestic abuse. Okay,
that is part of the history taking naman talaga. Pag meron kang signs of trauma, you always ask, no? You're duty bound to ask about history of trauma, and then you try to draw it out kung saan nanggagaling. So kasama yun talaga.
Yes, okay, and that can be tricky, I'm sure, for others like yourself, because we have. I understand why a lot of women don't talk about it. But that is a more psychosocial thing that a matter. But I want to bring it out here. Tell your doctor. Tell your doctor the truth. It might eyesight. Diba? Okay. And then, so in your experience, when do patients usually come in to address the fact that they have a cataract or that both eyes have cataracts? I mean, like, what stage of the progression are they in?
Yeah, so that's a good point to say kung both eyes na, no? Kasi usually, the onset of cataracts is very insidious, mabagal na mabagal. So you hardly notice it. It's like you wearing glasses, hindi mo nararamdaman na scratch na pala yung salamin mo until you examine it really closely, no? So people get used to the dimming and the very, very gradual dimming and clouding of vision over time. So until one day na lang they say, biglang lumabo yung paningin ko. But usually, makikita natin, it's really just a chronic problem that they just discovered, no? And usually, pag dalawang mata na yung affected, napapansin nila, because patients, unless you're the very hindi man OC, no, but you check one eye at a time, no, you hardly notice it because that's why you have both eyes. But some patients are very, they really watch out for their health. They check their eyes one eye at a time. Doon nila nakikita. But for the most part, malalaman lang nila pag may yung second eye, kasi usually asymmetrical ang progression yan. If the other eye is clinically significant na paglalabo, and then they'll say, parang malabo na yung paningin ko. So, dun mo napapansin, no? And it varies yung age, no? As I've said, some people get it later, some get it earlier, no? But on the average, siguro 60s, 70s, that's when they start 60s, siguro, noticing that there is some decrease in the vision already, no? Parang colors are not as bright, things are cloudy, they're needing more light in the house, no? So ganun yung mga symptoms nila usually.
Okay. And yeah, no, it's like, I mean, I wear glasses. You wear glasses, I can see.
Yeah.
Unless, so, you know, no, I'm just kidding. And a lot of people wear glasses.
Yeah.
And it's true. I mean, we're like, why is, and then you look, you know, oh my gosh, my glasses are
Ano na
scratched.
pala ka, it's so
Yeah.
scratched already, no? It's so dirty na, no?
Or we only notice at a certain point na tumaas
Yeah.
at grado ko You know, like we don't notice it right away. And I
Yes.
guess, is it also because like if one eye starts getting affected, the other eye tends to, or our brain perceives that the other eye is sort of making up for the vision?
Well, yeah, for the most part kasi nga, the other eye is there to compensate or to help, no? So you don't notice it as quickly, no? It's when the second eye starts failing that lumalabo na, no?
Yeah.
But again, it's very it's asymmetrical kasi, but both will progress. One eye just progresses a little bit faster than the other usually.
Okay. And then, are patients usually referred to you, or do they go to your office straight? Patients with cataracts?
Yeah. Mostly patients naman are educated about cataracts, no? Parang especially when they notice that it's getting the vision is getting poorer, they'll consult a doctor, no? They'll consult an eye doctor. Sometimes they will go to an optometrist, have their glasses checked. So sabi ng optometrist, hindi na natin maayos. You have to see the eye doctor already, no? So that's also another route, no? That's why our partner optometrists are also very helpful and important to us in diagnosing this, no? Because they're a lot of times they're the first line, no? Kasi you know, most of us will just go to the optometrist just to have our glasses checked. Ayaw naman magpa-doktor. Pag hindi na lang maayos ng optometrist, doon na lang nagpapatingin sa doktor, no? So, yeah, that happens also. But they come and see naman doctors. So,
my next question was going to be, can you tell us the difference between an ophthalmologist and an optometrist?
An ophthalmologist is a medical doctor, no?
Okay.
So we have to finish medicine so that we can do surgeries, no? An optometrist does parang grades, etc., no? They are doctors of optometry. They do 6 years, I think, of school, but they cannot do surgery, no?
Okay.
So that's the difference. That's the main difference, at least in the Philippines, no?
Okay, that's the main difference here in the Philippines. And because, you know, as I said, sorry, no, I did not say this yet. A lot of people will go to, let's say, a shop and like, okay, there's an optometrist here, and they won't really necessarily be able to tell the difference between an ophthalmologist and an optometrist. And I think, yeah, a lot of optometrists have been helpful in my experience in the past. Like, you should see your eye doctor. It's not that they compete in a you know, in an unhealthy manner with ophthalmologists, but
we work in tandem with them, no? It has to be tulungan talaga in order to provide proper eye care to the population, no? So walang turf war yan. Kailangan
walang turf war. So
kailangan magtulungan, no?
That's good to know. That's good to know, for especially because most people go to the optometrist first, because there is kind of like, why do I have to go to the hospital, see the doctor? I'm kind of afraid, or whatever it is.
Iba yung nasa mall lang, yung magpatingin. So it doesn't feel as scary, no? But you know, we're thankful naman that our optometrists actually they know naman when to refer, no? So
okay, that's great, doctor. We're gonna go into depth more about the symptoms of that one experiences when they have when they do have cataracts and a lot of these other things. So, but we just need to take a short break, doctor. So, and to the audience as well, I'm enjoying this show a lot. I'm learning a lot about not just cataracts, but eye care in general. So please stay tuned, and we'll be right back after this short break.
You're listening to DZRJ 810 AM. We'll be right back after these reminders.
Hi, Hi, this is Dr. 𝗛𝗶𝘁𝗵 from Makati Medical Center, and I'm happy to share that our world-class quality healthcare with the heart is now more accessible and affordable via Makati Med Mobile Care Access. As the name suggests, this service is mobile, which means that we go to where you are. Mobile Care Access deploys a team of professionals for face-to-face consultations and to conduct basic laboratory and diagnostic procedures, as well as vaccination and testing, depending on your needs. We can go to any location of your choice within the metro and readily offer these healthcare services to communities or groups. For added convenience, different modes of payment are available, including HMO benefits for those with a valid letter of authorization. We believe that access to affordable, quality, and compassionate healthcare is a basic human right, and we at Makati Med are doing our best to make this possible to more people. For inquiries, scheduling, or pre-registration, you may reach out to us at the following numbers. We look forward to coming to you and serving your community with Makati Med Mobile Care Access. Hi, this is Dr. 𝗛𝗶𝘁𝗵 and welcome to Makati Med Wellness Center. Located at Ayala North Exchange, the Makati Med Wellness Center is a warm and comfortable state-of-the-art lifestyle center where executive checkups and services that address holistic patient care and wellness can be done. We have a skin and laser hub, diagnostic imaging, health screening, mind and wellness care, and physical medicine and rehabilitation. The Wellness Center is equipped with modern facilities and staffed with competent healthcare professionals who are committed to deliver premium, personalized, and easy access healthcare services for both adult and pediatric patients alike. This is a great place to prioritize your health and well-being without having to be at the hospital setting. We are open from Monday to Saturday at 7 a.m. to 5 p.m. at the 7th floor of Ayala North Exchange, Tower 1 in Makati City. It is also accessible from the Makati Med Hospital through a bridgeway to Ayala North Exchange. For inquiries, you may reach us at these numbers. We look forward to serving you here at Makati Med Wellness Center.
You're back with Healthline, keeping you healthy. Moderated by Nicole Jacinto.
Okay, welcome back to Healthline with Makati Med. I'm your host, Nicole Jacinto. We are here with Dr. 𝗠𝗸𝗁𝗶𝗵𝗏. He's an ophthalmology specialist. We're discussing cataracts in particular today. And I just also like to thank AJ, our technician, and you know, in radio and TV, basta broadcasting, there are no holidays. So thank you guys for always being there for us. I'm sure for doctors as well, there are no real holidays. Okay, so Doc, but we are here to help inform, educate, and least of all, but not least of all, last but not the least of all, entertain you as well.
Yeah.
Doctor, before we go in a little bit more in depth into the symptoms of cataracts, can you tell us if there are any types of cataracts, or what are the types of cataracts?
Well, as I've said, the most common is when you talk about
maybe touch on it lang again. Yes,
yeah.
sorry.
Age-related cataracts, no, traumatic cataracts, no, metabolic related cataracts, pediatric cataracts, which include congenital and developmental cataracts as well.
Okay. So, doctor, when we experience certain symptoms, are there any symptoms like other than just, let's say, general blurring of vision
Yeah.
that you can sort of match with this type of cataract or that type of cataract
Um,
mentioned?
Yeah, well, there are also there's also a type ng classification of cataract according to the kind of cataract that you have, no.
Okay.
We call it nuclear sclerosis, no, cortical cataract, or yung posterior subcapsular cataract. It depends on kung nasaan sa lens nangyayari yung cataract. Nuclear sclerosis is a type of cataract which we usually find in age-related cataracts where the entire lens becomes darker and darker and darker and cloudier, no? So ang symptom niyan usually at the beginning, nagbabago yung grade, no? Tumataas yung nearsightedness kasi tumataba yung lens as the lens proteins nagkakaroon ng deposit. And then it becomes gradually cloudier and then mas malabo, no? Sometimes darker, you're needing more light to see. And then cortical and subcapsular cataracts or yung polar cataracts na tinatawag is a different kind of cataract in a sense that mas sumasabog yung ilaw dito. There's parang opacities, different opacities in the lens that sometimes that the most common symptom would be glare. No, parang when you look at headlights, when you look at the light in your house, parang sumasabog siya. May halo, no? Sometimes may halo yung or glare yung ilaw. And that's usually a different kind of cataracts, no? But sometimes hindi mahirap talaga siyang i-distinguish unless you get an examination, no?
Okay.
It's hard to distinguish from symptoms alone. But the general symptoms are cloudy, darkening, glare or halos, no, and generalized na parang mas lumalabo talaga yung paningin, no?
Okay, thank you, doctor. So it's really best to go to someone like you to be able to tell what kind of
Correct.
cataract it is, how do we go about treating it, how
Correct.
fast do you think this will progress, you know,
Correct.
and all of that. Now, are there any kind of eye conditions or diseases that a patient can mistake for cataracts? I mean, like, for example, has a patient ever come into you and said, I'm pretty sure I have cataracts because my vision, I don't know, my grade is going high, my vision seems blurry, I'm seeing halos around lights, and then it turns, it's not a cataract pala. Are there any cases like that?
Yeah. The disadvantage of cataract being the most well-known eye condition is that everything is attributed to cataract, no? Minsan nagdudugo na yung likod ng mata. Dok, may cataract ako dahil malabo yung paningin ko. Minsan, there's inflammation inside the eye or there's what you call this, nagaglaucoma at ano, because that's the most common condition that we know of. So parang ina-attribute lahat dun sa cataract, no? So maraming ganon. Papasok sa clinic, may cataract po ako. When you look at the patient, hindi siya cataract po, no? But that's just largely because it is the most well-known eye condition, no? So hindi naman dahil nagkakapalit-palit ng symptom kasi yun lang yung natutunugan ng pasyente. So either cataract or glaucoma. Yun usually yung dalawang sinasabi nilang meron sila, when in fact there's still a different kinds of conditions in the eye, no?
So I mean, the symptoms are symptoms of cataracts, but they could be symptoms of something else,
of other things as well, no? Parang cloudy vision can also be sometimes there's blood already inside the eye, no? There's inflammation in the eye. Glare can be a sign of parang may inflammation sa loob ng mata, no? So that can also be a part of it, no? So again, it's best. The problem with vision is that ang main symptom niya is panglalabo, no? So panglalabo, pananakit, pamumula. So yun lang yung so interchangeable lahat yung mga symptoms ng mata natin. So it's best really to see a specialist for that, no?
Yeah, I wanted to highlight that because as you said, that's the most common thing we know about, that and glaucoma. And well, you might go to the doctor, like a doctor like yourself, and you'll say it's a temporary thing. So, okay, don't have to worry yet about it being a cataract. Or you should go because also it might be something that may be actually more difficult to deal with than a cataract later on, and you want to catch it early.
It could be irreversible. So yun yung problema. No? Like glaucoma is irreversible, no? Diabetic retinopathy can be largely irreversible. That's why we need to inform patients na kailangan kayo nagpa-follow up. Hindi lang magpatingin minsan, no? Pero kailangan nababantayan, depending on what we see.
I'm guilty of that, it's my grade going up, but I have to do this thing for 2 more months, so I'll just wait, I mean, I've been wearing glasses for like most of my life, so I'm still guilty of that. So yeah. Okay.
Yeah, you need regular checks, okay?
Yeah. We can discuss that more in depth later about regular checkups and all that, and you can tell us exactly why and what's your advice. Now, the cataracts, I'm curious, the cataracts, if we're talking about cataract strictly, it's confined to the condition of the natural lenses we have in our eyes. Would you say it's like bleeding in the eye? Is that the retina? Or maybe we should
usually at the back, the retina. Yes.
So the retina's at the back. I've forgotten my parts of the eye. If you could just go through it quickly for me and for the...
So the very front of the eye is called the cornea. This is what you reshape with, LASIK surgery, yung laser corrective surgery. That's what you reshape. Yun yung pinaka-outer part ng mata natin. And then in between is the lens. That's where you'll find the natural lens. And at the very back is the retina. This is like the film of the camera. No? So kumbaga, ang mata natin parang camera. Yung pinaka-lens system niya, yung nakakatanda pa nung regular SLR camera na may film. No? The lens system is the cornea and the lens. No? And the film of your camera is the retina.
Okay.
So kailangan lahat yun ayos. No matter how expensive your lenses are, if your film isn't working, you don't get a good picture. No matter how nice your film is, if the lenses are dirty, you won't get a good picture.
Okay. Thank you, doctor. And okay, so how are cataracts diagnosed exactly by specialists like yourself? I'm curious, can you see them through the naked eye? Do you ask certain type of questions, or are there any procedures? Like, what procedures do you or tests do you conduct to properly diagnose cataracts?
So to diagnose a cataract is basically like diagnose any other eye condition. No? You need to take a good history of the patient. When did the blurring start? How did it start? Sa dalawang mata, sa isang mata, paano nagsimula? Maulap ba kagad, madilim, may pain, may redness? You try to draw that out from the patient. Are there any associated conditions, diabetes? No? So we have to look for that. And then after that, we do an examination of the patient. We check the vision of the patient. We check the grade. And we examine the patient with an instrument we call a slit lamp, which magnifies everything. No, okay. So we can see the inside of your eye with this equipment called the slit lamp, and then that's where we will see the opacity of your lens. No, now can you see a cataract with the naked eye? Sometimes when it's very, very white. Makikita mo yung gitna ng pupil niya puting-puti, but that's very, very severe already. For you to be able to see that, that's quite advanced. So we see that in areas with with low access to healthcare na talaga nagpo-progress to that level. And yun, nakikita mo pa lang, palapit pa lang yung patient, meron na tong bilateral cataracts. Kasi kita mo puti yung sa gitna ng mata nila. But for the most part, we use instruments that magnify the view of the eye so we can see.
Okay, thanks. And doctor, when are these instruments available at optometry shops too, or depends on the shop?
It depends. No, there are bigger opticals that do that, but I'm not sure kasi what the protocol is now for our opticals if they do a full exam. Sometimes kasi pag hindi talaga makuna na yung grado, that's when they refer, no? Pag hindi na makorek. There are optical shops that do an examination. I'm just not sure how,
if they have equipment.
If they have equipment. No? Mahal din kasi yung equipment. So it's also quite,
And also, when we walk into an ophthalmologist clinic, you said you magnify it. Those are the first the interview.
Yes, that's really important. No?
That's really important. So just be honest about stuff. Also, by the way, I have diabetes, diba?
Yes.
Also, by the way,
sometimes kami yung nakaka-discover ng diabetes.
Kayo rin.
Hindi alam ng pasyente, and then ito yung symptoms niya, no? And then we examine the eye. Nakikita na namin there are signs of diabetes in the eye. And then you ask them, mataas ho ba ang sugar nyo? Hindi ho. And then you ask them to do a test. They'll confirm that they have diagnosis. Hypertension. Sometimes you're unaware that you're hypertensive. When we look inside the eye, we will see the small blood vessels are hypertensive. So tama yung saying that the eyes are the windows to the, not just your soul, but to your body, to your health. No? So we can see a lot of conditions just by looking at your eyes. No.
And what can cause the bleeding in the bleeding of the eye? I know we're not on a particular, illness or condition, but what can cause bleeding in the eye when it?
You have very small blood vessels at the back of the eye, no, that bring oxygen to the retina, because that's really how you see. It's a light-sensitive membrane at the back, no, na may mga kailangan niya para function is blood supply, no. So in certain conditions, like diabetic retinopathy, you grow abnormal blood vessels there. In cases of eye stroke, no, pumuputok yung mga ugat doon, no. So it's the small blood vessels in the eye that cause the bleeding, no.
So there is such a thing as eye stroke, because
yes. Nag-stroke yung mata, just like the brain, no. So it's an extension kasi of your brain, no?
All right. Yeah, I was told by someone before that they had an eye stroke and they shouldn't be cooking too much or something like that because of the pressure. I was like, okay.
Baka lang, wag tumaas yung blood pressure.
Okay. Yeah. Right. And yeah, maybe cooking for people
stresses you out.
Yeah, maybe it's stress out or pissed her off or something like that. I was like, okay. I'm glad I get to ask you about that years later. And then also, like, wait, as you were talking, there was something. There was something I did wanna ask. I hope I remember that question. That it comes back to me. And okay, we're just gonna take a short break, doctor, before we really go into, like, what are the treatments that can be done if you have cataract and all of that stuff. I have a feeling you could talk about everything about the eyes, and I'm like, just shoo. My brain, okay. I'm dying to ask you so many questions, but I'm trying to stick to the topic. So okay. Anyway, doctor, if you just hold on for a bit, and to our listeners and our viewers, please stay tuned. This is Healthline with Makati Med. We're with Dr. 𝗂𝗵𝗹𝗁, ophthalmology specialist. I'm Nicole, Jacinto, your host. We'll be right back.
You're listening to DZRJ 810 AM. We'll be right back after these reminders.
World-class quality healthcare with a heart is now more accessible and affordable with Makati Med Care Access. I am Dr. Jacinto from Makati Medical Center. Our mission is to serve and provide compassionate care and excellent service to everyone who needs it. And now, we are bringing our renowned brand of world-class healthcare to where you are. With Makati Med Care Access, we have expanded our services beyond the hospital premises to serve you in convenient locations where you can avail of premium but economical healthcare. The Makati Med Care Access Araneta City is where we offer health screening and diagnostic procedures. Here, you can get services such as mammogram, ultrasound, lab procedures, ECG, and many others. What's more, Makati Med Care Access Araneta City is the only single-use hemodialysis center in Araneta City. This makes it easier and convenient for patients to avail of renal care services right in the heart of Cubao. Here at 𝗂𝗶𝗵𝗶, another Makati Med Care Access Clinic is located, offering outpatient care like consultation and diagnostic procedures such as medical assistance, hospital admission assistance, blood pressure monitoring, laboratory tests, and X-ray, among others. This is really convenient for those residing in Makati and nearby communities who do not want to proceed to the hospital to have these treatments and procedures done. The Makati Med Wellness Center, located at Ayala North Exchange, is a warm and comfortable space where executive checkups and services for holistic patient care and wellness can be available. In this wellness center, we have a skin and laser hub, diagnostic imaging, health screening, mind and wellness care, and physical medicine and rehabilitation. It is equipped with modern facilities and has competent healthcare professionals who are committed to deliver premium, personalized, and easy access healthcare services to adult and pediatric patients alike. It is connected to the main hospital by a bridgeway at the side of Ayala North Exchange. To make our services more accessible to certain areas, the Makati Med Mobile Care Access was launched. As the name suggests, this service is mobile. We go to where you are. Mobile Care Access deploys a team of professionals for face-to-face consultations and to conduct basic laboratory and diagnostic procedures, as well as vaccination and testing, depending on what your community needs. We can go to any location of your choice within the metro and conveniently offer healthcare services to fit the needs of any community or group. For added convenience, different modes of payment are available, inclusive of HMO benefits for those with a valid letter of authorization. Now that is truly accessible healthcare. All these additional locations under Makati Med Care Access are meant to make it easier for more people to avail of our services. After all, access to affordable, quality, and compassionate healthcare is a basic human right, and we at Makati Med are doing our best to make this possible to more people. For your healthcare needs, please visit us at the following Makati Med Care Access Centers or contact us to come to you and allow us to take care of you.
You're back with Healthline, keeping you healthy. Moderated by Nicole Jacinto.
Okay, welcome back to Healthline with Makati Med. Folks, we're here with Dr. 𝗠𝗸𝗁𝗔𝗵𝗋, ophthalmology specialist, and I am Nicole Jacinto, your host for this show. We are discussing cataracts today. That's our topic. But, we talk about eyes somehow because, it's Dr. Valero eyes, we want to know different things about our eyes. And as he said earlier, the eyes really are the window into someone's body or state of health because they can tell you a lot of things. Sometimes ophthalmologists are able to inform people, alert them to the fact, some of their patients to the fact that they may have diabetes or they may have high blood pressure and all these other things. Just by looking at the eye, they can tell those things, folks. So it's a good idea to go, to have your eyes checked regularly anyway. If that's easier for you than getting a blood tester monitoring your blood sugar or, high blood pressure, even early on, even if you suspect that you may be going overboard a bit. The doctor, as we say here, you've got questions, you've got answers. And actually during the break, I checked some of the questions, and I was not texting with my friends, doctor. I would never do that to you. We have okay. One from Andrew. He says to just be called Andrew. He has a 𝗠𝗸𝗁𝗶𝗶 left eye. I don't know if that's cataract or what it is, but he would just like to ask you about it. 𝗠𝗠𝗁𝗶𝗶 left eye, and he uses 𝗪𝗪𝗪. So I guess maybe if you can tell us a little bit about that for Andrew's consumption.
Yeah. Well, I think what he means is a 𝗠𝗠𝗁𝗪. This is basically a kulite, no? Kulite. That's the scientific term for a kulite. And what he's using is an antibiotic steroid combination medication, no? A kulite is basically an infected in your eye, no? In your eyelid, no? You have to treat it, no? It's like a pimple in your eye, no? Kuliti talaga siya. You have to treat it. If it's small, you can use topical medications, no? But sometimes it becomes chronic and you'll have to operate on that pag tumigas siya, no? So it should go away in a week or two, at least the major swelling. But if it doesn't go away, you have to see your doctor again and see if there's anything else that we need to do.
So that's like a sty.
Yeah, it's a sty. So
Eye, the eye. Yeah, okay. So that's like
sty of the eye.
yeah, sty of the eye and kuliti as we know it.
Kuliti, yeah.
Yeah, that's so painful.
Yes, it's
Actually,
painful. It's very painful. No.
irritating. And okay, we have another question here from Minnie. If you're asked to lubricate your eyes 4 times a day by your eye doctor and you don't, can that lead to cataracts or worse?
No, it can cause other problems. No, lubrication of the eye is because your eyes are dry. No, there
Okay.
are several causes of dryness in the eye. It's just normal environmental causes. No, palagi kang nasa computer, you tend to stare, you work in an air-conditioned room, everything is very dry. Your eyes will really get dry. No, that's why in these cases, we advise the patient to lubricate their eyes so that it feels better. It's like having a dirty windshield, no? When you're driving, na madumi yung windshield mo, wala kang nakikita, no? So the lubricant is there to clean, no? To parang clean the windshield, no? So and it makes you feel better, no? If you don't, you'll feel the symptoms, no? It doesn't lead to cataract, no? It doesn't lead to cataract.
Doesn't lead to cataracts. Okay.
Yeah.
So I do know patients who have had cataract surgery, but we'll get to that a bit later.
Yeah.
Who have to or who are told to,
Put drops.
take drops also. But we'll get to that later.
Yeah.
And the last question here is someone who posted on the chat. I guess it's Alan Cledera. It says, Dr. Valero, this would be more interesting if the cataract or any eye disorder is argued as a community-acquired disease, CAD. If you have any answer to that?
It's not a community-acquired disease. No, it is considered under the DOH as one of the non-communicable diseases. No, unfortunately, hindi. No, so hindi natin siya pwedeng ilagay sa community-acquired. No. It is a degenerative condition, no? So it really is something that happens to you. Again, for the majority of the cases, it's something that is acquired as you age, no? Actually, hindi nga acquired eh. Parang it happens. It's a degenerative eh. Oo.
So, basically, hindi to nakakahawa.
Hindi nakakahawa. Hindi nakakahawa.
Catarata. Let's not start.
Yes.
That kind of misinformation. But
yes.
Okay, why would it be important for some to argue it as a community-acquired disease?
I don't know, maybe coverage for health. For health. But it's covered by there is coverage for PhilHealth for cataract. No, it depends on where you do your cataract surgery that it can be totally covered by PhilHealth. In some, it cannot. No, because unfortunately, it only covers a certain amount. No? So, depending on where you are, pwede makover lahat, pwedeng hindi. So.
Okay. Thank you, doctor. Thank you for answering those questions. And then, let's get down to it. What are the available cataract treatments options for those with cataracts? There may be different options. So,
all right. It will depend on the stage of your cataracts. No, in the earlier stages of cataracts, when parang nagbabago pa lang yung grade mo, increasing myopia, increasing nearsightedness, just change of glasses will be okay until a certain point. No, when the opacity is not yet severe enough. No, when the blurring of vision becomes significant for you, no, for the patient, no, that is when we talk about surgery. No, I personally do not give eye drops for anesthesia, for cataract. No, I don't believe that there's enough evidence that the eye drops will reverse cataracts. Some people say it slows down the cataracts. That's arguable, but it doesn't hurt, but does not reverse. No, it does not reverse cataract.
It does not reverse.
It does not cure the cataract. So that's for sure. Sigurado tayo doon. Whether it retards the growth of cataracts, that's up for argument. There's some data that says it does. There's a lot of data that says it doesn't. No, so kung ipangungutang mo pa yung pambili ng eye drops for cataracts, I probably will not. No, I will not advise you that. If the opacity, if the blurring of vision, then this is subjective. No, becomes severe enough to affect your lifestyle. nahihirapan ka ng gawin yung gusto mong gawin, nahihirapan ka ng gawin yung dapat mong gawin, that is when we talk about surgery. No? Because the only way really to fix a cataract is surgery. No? And then the third is kapag nagko-cause na siya ng ibang problema, and then it becomes not the choice of the patient anymore, but an advice of the doctor na parang kailangan mo na tanggalin or else we'll have other problems. No? But the majority of cases, it really is the patient's choice on when to do the cataracts. I've had patients, very, very severe cataracts, but because what they do is just, they listen to the radio, they play mahjong, parang, okay lang ako, I'm okay. No? I have patients of very, very mild cataracts, watch repairman, dentists, doctors, those who read a lot, they want to do it earlier. No? Because it's affecting.
They need to focus. It's affecting,
So it's affecting your
dentist.
It's affecting your lifestyle and it's affecting your livelihood. No, it's affecting your safety as well. So those are the most important considerations.
Yes. So the considerations are, one, how bad is it? Perhaps it can be addressed. And your answer to that, I guess it's how bad is it progressed?
Yes.
And sometimes it can be addressed. Changing lenses. I'm talking about glasses, no?
In the earlier stages, no?
Earlier stages, okay. But that will still not retard it.
No, it will not. It will not reverse it as well. It can parang temporize, no? Kung hindi pa naman ganun kasama, then pwede pa naman, no?
Okay. And then you said that it's usually the patient's choice, unless the doctor says, you need to take that out because it's going to cause even bigger problems. Yes.
Bigger problems. Irreversible problems.
Irreversible problems. Okay. And when that happened, and you also said some people choose to have it taken out early because they need it. They need to see clearly for their livelihood.
Yes.
Yeah, I was going to ask you, do some people, you say, maybe they're in their 50s pa lang, or you say, I have cataracts. They say, take it out now, let's deal with it. And also,
correct. If you remember the concept of yung hinog na catarata, yung mature cataract from before, no?
Yes.
That was because the surgery for cataract before was a little bit more difficult, a little bit riskier, no?
Yes.
A little bit more complicated. Right now, modern cataract surgery is one of the most successful surgeries and fastest surgeries that we do, no? It's an outpatient basis for the most part. Topical anesthesia, eye drop anesthesia lang. You don't have to put you to sleep, no? And then the recovery is very quick for the most part, no? So, as the procedure becomes safer, mas nai-offer natin earlier to the patients because it rehabilitates their vision, no? Hindi katulad dati, you really have to think very, very hard. Kailangan ko ba talaga yung surgery? Kasi delikado yung surgery. Ngayon, the margin of safety is increasing and increasing and increasing. It becomes easier for the patient to decide to have it sooner. And also the demands of people now, the visual demands are changing, no?
Yeah.
Dati talaga, basta makalakad ako at makita ko yung kausap ko, okay lang. Now, we have demands like, I need to be able to see my phone. I need to be able to see my laptop, no? So ang daming demands natin ngayon that is different from before. So the nag-shift din yung paradigm natin on when to do the cataract surgery because of the safety of the procedure, the increasing safety of the procedure, the increasing demands of the patients as well.
And the advanced technology of just having, eye drops as
anesthetic.
Yes.
Yeah.
That is wonderful to hear. And I'd like to emphasize that before we always hear the term pag hinog ng catarata. And in English, it's translated roughly as when the cataract is ripe.
Right?
Like,
or mature.
When you can't, parang it's so bad already that we have to do it.
Yeah.
But now, as you said, with advancements in medical advancements, even surgery and all that stuff, it becomes safer. You said the margin of safety becomes safer and it gets easier to do it, and it's an outpatient procedure. Can we go into that actually, doctor? And yes, so before we get into the what happens exactly during surgery and what you do. So having cataract surgery, is that the cure for cataracts?
That's the cure for
That's the
cataracts.
cure. Okay, so
Yes.
that's the cure talaga.
Yeah.
Not really eye drops or
Mhm.
whatever, or something out there that someone offers you, like I'll spit in your eye and then you'll get cured. No.
The other thing is that you'll hear people saying, bakit yung nanay ko, yung lola ko, never naman na-operahan ng katarata, no? Umabot ng 90 years old. That's because also, baka hindi rin naging masyadong makapal yung cataract. Kasi nga,
Yeah.
iba-iba tayo ng or iba rin ang visual demands nila. No?
Yes.
Diba? Parang, my lola just liked parang playing mahjong. So, hindi siya masyadong demanding in terms of vision. So, she never had cataract surgery.
Yeah.
She, di ba, at a very advanced age, no?
Yeah.
But now, yung hinog is very relative eh. Parang para sa akin talagang hirap na ako, no? But para for another person, hindi masyado. So, yun nga. So, again, it's the patient's choice in the end.
Okay. So, doctor, what happens when we go into cataract surgery, when a patient goes into cataract surgery? Can you explain to us like the preparation and then the...
All right.
Okay.
Very important when we talk about doing cataract surgeries. Again, we get a very good history, to make sure that the patient doesn't have other problems na may mabubulaga tayo during surgery, That we also do a very good exam, an eye exam, to make sure that the only problem is cataract, Because sometimes cataract can coexist with other problems, Like in patients with diabetes, you can have diabetic retinopathy, which is bleeding at the back, and the cataract. So pag hindi natin hinanap yun at ginawa lang natin yung cataract, sometimes the patients will be disappointed after the surgery. Bakit hindi luminaw yung paningin ko, kung tinanggal mo yung cataract, even if the cataract surgery was unremarkable. That's why we have to make sure that before the surgery, we know that what the prognosis is, Pag meron siyang 2 o 3 problema, alam natin pag tinanggal natin yung isang problema, we'll probably improve it by a bit, not but by a whole lot, So we do all sorts of tests, We do a very detailed examination of the eye. And then after that, what we do is we measure the implant that we are going to put, So para kang nagme-measure ng grado ng contact lens na ilalagay mo sa loob ng mata. Because the additional benefit of modern cataract surgery is that we now have implants that will correct your grade.
Okay.
So you, eventually, when you have your cataract surgery, I can put in an implant inside your eye that will take out the need for you to wear glasses. So that's another advantage. That's why also people are getting it a little bit earlier kasi mas exact na rin yung pag-measure namin ng implant. So after that is measured, depending on the other needs, hahanapin pa rin namin kung ano yung talagang pinakamagandang implant para sa'yo. And then we schedule you for surgery. Sometimes we ask for clearance from your cardiologist or your diabetes doctor if there's a very significant issue. But for the most part, since this is done under topical anesthesia, karamihan, very quick yung process to schedule, unless very sickly ka, mahirap na operahan, Of course, we have to watch out if you're taking blood thinners, all those things, Kailangan natin i-manage lahat yan, And then during the day of the surgery, what we do is we put some drops in your eye to dilate your pupil so we can see the cataract better. And then we wheel you into the operating room. We put eye drop anesthesia. This is yung purely topical cataract surgery natin. We clean your eyes. We put something to keep your eye open. And then under the microscope, we use an operating microscope so that we can see better. We make a tiny incision on your eye, and then what we do is we fragment the lens, using high-speed ultrasound. A majority of cases now, 2 klase yung usual surgery natin, The more modern cataract surgery is you use a high-speed ultrasound to parang fragment the lens, parang dudurugin yung lens, and then you suck it out through a small incision, and you put in an implant through that small incision also, Pag masyadong matigas yung cataract, or if you don't have access to those high-speed ultrasound machines, you can also do a larger incision and then bring out the cataract na buo, And then you put in the implant. So those are the types of cataract surgery. And then after the implant is implanted, wala nang, for the modern cataract surgery, wala nang kailangan na stitch. No, we don't even put a suture anymore. No, and then if all goes well, no, the next day you'll be fine. No, you can see better. No, and hopefully sakto na yung grade mo. No, so yun yung.
When did you start not stitching it up afterwards?
Siguro in the type of surgery started in the gained a lot of traction in the Philippines. Siguro 90s, no? Matagal na yun. Matagal na yun, no?
Oh, okay. So, and then, as you said, no, sometimes, I'll go back a bit. I'll recap a bit for the preparation process.
Yeah.
It may take a few days because you'll examine the eyes very thoroughly.
Yes.
Then you may need to work in conjunction with other doctors, especially if there are other conditions like diabetes or high blood pressure or heart conditions.
Yes.
And then they may need to get clearance. A patient may need to get clearance from one of their doctors, and because they might be on blood thinners and all of that. So blood thinners, we know, are things that usually a cardiologist or an internist or somebody else will give, another type of doctor will give you, thin out your blood to help with your blood pressure, and so you don't
circulation.
Your circulation. Okay. And then and then those are, I guess they would know what the clearance is with their cardiologist or endocrinologist if they have diabetes, or is that the doctor that treats diabetes? Yes, probably.
Yes.
I don't know. Yes. Okay. So then they would there are things like that. Do you do the PTT, meaning the clotting time of the blood? Do you also
It
test?
depends on the doctor, and it depends on the condition of the patient. No, I would usually, unless the patient is on very, very strong blood thinners, I don't know. I just ask the attending, the internist, pwede bang itigil yung nurse, no? Kasi kung hindi talaga pwede, we don't have a choice. We can't do it, no?
Yes.
Life before sight, no? Hindi, I won't stop the blood thinners and just to do surgery and cause the patient to have a stroke or a heart attack, no? So hindi, we won't do that, no? So we have to find another way, no?
Okay. So that's good. That's good to know, doctor. And then so I usually just map out what the preparation process is for the viewers and the listeners, so they know that it's what it entails. Because a lot are like, what a hassle, or I'm afraid of prodded, and well, that might just entail a blood test. If you're under blood thinners, you probably go to a doctor anyway. I hope you're not taking them drone,
Yes. But and we also ask if you're taking like fish oil. Sometimes that can also cause thinning of the blood, no? So although hindi significant, we just ask that, no? I personally ask that. No?
Yeah, because a lot of people be taking like omega-3 fish oil.
Then sometimes herbal medicines, no, parang kung ano tinitake na feeling ng patient, it's just to make me healthy, without knowing that it actually causes other issues. That's why it's important for us to ask
or something like that. Yeah. At least you're also more like up to date now with you as doctors. You have to learn also all the herbal things, because people would I'm taking this and that. It's just, it can't hurt because it's natural, but it
or sometimes they won't even tell us because they don't consider it as medicine, no?
Yes.
So you always have to ask, are you on medications? Are you on vitamins, supplements, herbal medicine? You have to spell it out talaga. Kasi minsan hindi sasabihin, no?
And they also, because people don't think of it as, medicines. They don't understand that, the reason why this is good for you is because this one thins your blood. Also just reminding people like me out there who are not medical professionals that a lot of actually our medicines started from herbal stuff. Especially in the early days, they were not synthesized in labs. They all started from mostly plants that people, crushed up and put together, all of that. So, okay. You mentioned a couple of things. Okay, like I'll talk about the aftercare a little bit. I'll ask about that in a bit. But when you change the natural lenses of the eyes, what material do you use to put in?
It depends. No, the most common material that we use now is acrylic. No,
acrylic.
There is also silicone lenses that we use. But the three common materials, PMMA, which is polymethyl methacrylate, no? That's parang a hard plastic, no? So that's very stiff, no? That's what we use when we have a big incision because hindi mo pwedeng i-fold yung lens na yon. And then silicone and acrylic are very soft, para siyang contact lens. So you can roll it and insert it through a very small incision. So these are the three materials.
So mostly plastic. I mean, plastic-based materials.
Yeah, acrylic is the most common material that we use now.
Okay. So, and you mentioned contact lenses. I was going to ask you, so the new lenses now can act like contact lens, like permanent
Yes, parang
lenses.
implanted na yon. Yung grado na ginagamit mo, instead of what you call it, instead of putting it every day, parang we compute the grade already so that what we put inside the eyes is parang sakto na for your eyeball, no?
Can you tell us the difference? Okay, first, can you tell us how exactly do we get like this grado, no?
Yeah.
Hindi 20/20 vision, and then secondly, yun muna.
Yun muna. So a normal eye, considered normal eye, 20/20 vision without correction means that your lens and your cornea, the refractive surfaces of your eye, is exact for the length of your eyeball.
Okay.
If your eyeball is too long or too short, the focus will fall either in front or at the back of the retina. So it's like out of focus ka. Kaya kailangan mo lagyan ng lens in front to correct that out of focus thing, no? Now, so that is either farsighted or nearsighted, no? So that's what happens in the natural state, that you have an error of refraction that we call, no? When we do cataract surgery, the lens that we will implant will take into consideration now the length of your eyeball, the refractive surface of your cornea, etc. We compute that with a little bit of parang guesstimate involved to parang approximate na aabot ka sa 0 grade, no, at the end of the procedure. It is not yet a perfect science. Meron kang konting fudge factor dyan, but we try to approximate 0 grade, no? That is the goal usually. Or sometimes we approximate parang you're a little bit nearsighted so you can read, no? And then the other thing about modern cataract surgery now is that we have implants that are also multifocals or bifocals or trifocals, no? The standard implants are monofocal, which means you will be corrected for distance. Yun yung standard. We correct you for distance so that you can walk, you can cross the street. And then you just have to wear reading glasses, no? So that's the standard implant, no? There are now, over the course of the last few decades, nagkaroon na ng improvements in the technology. We are able to implant multifocal implants, no, that will correct you for distance and near, and sometimes now meron ng mid distance, no. So you'll be able to survive without glasses if everything else is okay naman, no, for that you can see well when you're looking at far, and you can see well when you're looking at near. So these are modern implants that we use now.
Is the mid distance because of, like, let's say, our use of computers more often?
Computer.
Okay. And then the reading, like when because
reading is usually mga a foot away, no? Computer is a little bit farther, and then distance is parang infinity or 20 feet and more.
Okay. So I remember we have terms like 𝗶𝗶𝗶𝗶. So ngayon 𝗶𝗶𝗶𝗶.
Yes, trifocals. We call them trifocals. No? It will still not be like your natural lens when you were 20 years old, no? It will never be like that, no?
Yeah.
I don't think we will ever get to that technology anytime soon, but it approximates it good enough that you can be what we call spectacle-free, no? And for the most activities, kaya mong gawin. No? Maybe you won't be able to read the very, very small print of the medicine, no? Yun, kailangan mo pa rin na reading glasses. But reading text, kaya na yan with the newer implants, no?
So it can correct nearsightedness. The lenses that you place can sort of correct nearsightedness, farsightedness, and even the
mid,
the mid that falls in between that. And you've explained to us what actually happens when you don't have 20/20 vision. What about, okay, LASIK?
Yes.
Okay, so do you not need LASIK anymore if you
Yes.
never got it? Okay.
Yes.
You
So
don't need
LASIK, what LASIK does is that it reshapes the front of your eye, your cornea. So it changes the refractive index, the refractive power of your cornea, so that the focus falls on the retina. So parang sharp focus, no?
Okay.
Of course, it works pag wala ka pang cataract, no?
Yeah.
Kasi kung may cataract ka na, parang sayang naman magpa-LASIK ka, no? So there are two ways of fixing the refractive error. Several ways: glasses, contact lenses, and surgical ways, which is LASIK, or when you have cataract, just replace the lens inside. No? So yun yung goal natin is really to when you have cataract surgery is to come up with a grade that will allow you to be zero grade, no, or as close to zero as possible, no.
And sometimes with LASIK surgery, no, they say you can't have it because your corneas are convex or something like that.
Yeah. Sometimes, if your corneas are too thin, sometimes if your grade is too high, kasi what you do is you shave off parang tissue eh. Pag masyadong manipis yung cornea mo, wala ka naman siya shave, no, masyadong ninipis, no? Or pag masyadong mataas yung grado and you have to shave off a lot, even if the thickness is normal, hindi rin kaya, no? So
or like a history of keloid scars or something.
Hindi naman, no, but that you can also have problems with scar formation with LASIK, no, as with any other surgery.
Yes.
No? So but implants now kasi have kahit gaano kataas na power, meron ng available eh. So mas accessible na siya talaga.
Thank you, doctor. So we've established that basically the cure talaga for cataracts is getting cataract surgery, and that you simply, I mean, it's simpler now, a much simpler procedure.
Not necessarily simpler, it's
for you.
Safer. No, it's more predictable. More predictable. It's safer. The technology makes it safer, no? Okay. It's not simple because mas maraming makina, but there's more technology in hopes of making it more safe, more reproducible, and mas predictable.
Great. That's great, doctor. That's good news for everyone who has ever delayed or thought that, oh God, I don't want to risk it. I'll just live with this cataract, you know. And the aftercare would still require, of course, a visit to you.
Yes.
You know, and in a couple of weeks, and putting different types of eye drops.
Yes, eye drops. We usually put the patient on antibiotics and anti-inflammatory eye drops. And for the most part, that's what we use, no? And then we follow up the patient usually a day after, a week later, no, just to make sure that everything is okay. No?
And you do make patients wear protective glasses.
Protective glasses, no? Dati kasi, di ba, naka-eye patch, naka-benda pa yan. If you see the old movies, no? That's because you really have to put a lot of pressure in the eye so that it doesn't bleed. But now, because the incisions are sutureless, you don't even cut into tissue that will bleed, no? You can just put goggles, no? And mas maganda yung wound structure natin ngayon.
Okay, that's great. Doctor, I'm gonna rush my next few questions.
Okay, sure.
Well, I got so into the conversation that I just want to stress, what are the importance of getting regular eye exams?
It's very important, no? Again, do not wait until you have very severe symptoms until you see a doctor, no? An eye doctor. I usually tell my patients at a certain age, if you're not wearing glasses naman, maybe at 50 you should be getting annual checkups already. If you're wearing glasses, you should have it checked regularly just for change of refraction and to see if there are any other issues. If you have symptoms, see your doctor right away. No, don't wait for it to get worse bago kayo magpatigin, because some of these conditions are irreversible. The parang inconvenience of seeing a doctor early on beats the consequences of a misdiagnosis or parang na hindi ka na diagnose at lumala yung problema.
And what would you consider a proper eye exam? I mean, do you just like go to an optometrist or you go to an ophthalmologist to make it?
You can do both. You can do both. No, of course, an optometrist will check your grade. No, but for a thorough eye exam, an ophthalmologist will be the one to do that. No, so we look at it from front to back. No, and see if there are other tests that we need to do. No? So,
Because you have the equipment also.
yes.
And okay. And also, but, I remember a long time ago, the ophthalmologist sold also glasses kasi sama pa kukunin, di ba?
Yeah.
So of course now good we have optometrists and good we have more convenient places to get the eye exams and the eyeglasses, but yeah, probably once a year go to a doctor. You can do both as you said, but for more serious problems. And maybe you won't have any problem, but you just
and then if you were already diagnosed as having an eye problem, you still need to, especially because you've been diagnosed to have an eye problem, regular checks. Very, very important.
What would you consider regular? Once a year?
Once a year is for the, again, for the most part, that's adequate. No, there are conditions like diabetic retinopathy that you will need to be seen more regularly. Glaucoma, you will need to be seen more regularly. Other issues, baka nga mas often pa. But it's best to see a doctor and ask kailan yung next follow-up and stick with the follow-up. No?
Yes.
Kasi I'll see you in 3 months. In 3 years, babalik yung patient. Medyo
I'm guilty of that too. I know. And
everyone's guilty of that. Everyone's guilty of that. But so...
Yeah. But don't be afraid to go back to your doctor.
Yes. Kasi nga, sometimes it's the treatment for earlier conditions like glaucoma. It's easier to treat with just eye drops if it's early. But if we catch it late, you will need to undergo surgery. Sometimes it's too late also, no? So the earlier you catch it, the easier the treatment will be.
And then, doctor,
the better the results.
The better the results. For you, diba? Okay.
Yeah.
And then, doctor, also, like, just quick, like, I couldn't get it out of my mind earlier when we were talking. When you go to an eye exam, doctor, optometrist, whatever, we have this prescription, right?
Yeah.
Just maybe even something for our viewers and listeners to know. It says OD, right eye, OS, left eye, OU. So
both eyes.
Okay, both eyes. Like that is the why we have that there.
Yes.
Because, ano to? Or what's this?
OD means oculus dexter. OS, oculus sinister. Something.
Yes, and OU.
Remember it right. Hindi ko na alam yung U.
Peter, naks ako.
There you go.
Ano ko lang before yan. Trivia.
So both yun.
So I would really ask because I'm the one who would bring the patient, what does this mean? So we're making sure it's the right eye, right? Because it says because Dexter in Latin is right, sinister, left. Mga ganon lang. Pero that's why those things are there. So, we also make sure, I guess, if you don't go to a reputable eye shop, parang I'm just...
Always ask. It's your right and it's your responsibility to ask if you don't understand. Whether sa doktor, whether sa optometrist, if you don't understand anything, if you don't understand something, please ask. Kasi we assume that when you say yes, you understand. Kung hindi nyo naiintindihan, hindi po masamang magtanong. Uulit-ulitin namin kasi that is for the benefit of the both of us. That you understand the instructions well, you understand your condition well. No? Sometimes, may makikita akong pasyente na diniagnose sila, hindi nila maintindihan kung ano yung sinabi ng doctor. Sinasabi ko, dapat magtatanong po kayo. And then, if you want us to write it down, we'll write it down for you. No? Kung ano yung condition, ano yung treatment, and you can bring your entire barangay para mapag-usapan natin. That's what we always tell our patients. No, kailangan alam nila.
Okay. Thank you so much, doctor.
You're welcome.
Please come back on the show again, okay? And we can discuss other stuff.
My pleasure.
Do you have any last words or advice for people with cataracts or anything that have to do with eyes as well?
Don't forget to have your eyes checked regularly. That's the most important message I can give your audience and everyone. No, don't forget to have your eyes checked regularly.
Okay, thank you so much, Dr. Valero. I look forward to actually meeting you in person, if not
pleasure,
and somebody else Well, I mean, I can tell you would calm a lot of patients down, especially very inquisitive patients. Okay, I'm the whole barangay they tend to bring. That's why.
Yes.
Okay, thank you, doctor. Thank you so
You're
much.
welcome. Thank you. Thank you.
Thank you for being on the show. So Mondays 5 to 6:30 p.m. Manila time, but of course you can watch it anytime, anywhere in the world through streaming platforms. Healthline with Makati Med. We'll see you again next time. Bye, Doc.
Thank you.
Thank you for tuning in to Healthline with expert doctors from Makati Med, giving you the chance to interact, uplifting your lifestyle. Moderated by Nicole Jacinto. Tune in again next week for your weekly dose of Healthline.